Guys, this is Constantine from PKL Physical Therapy, and today I'm going to show you some exercises to treat hip flexor pain. Now, hip flexor pain is usually felt on the front side of the hip, and it shouldn't be confused with other types of hip pain that can occur on the lateral side or on the back side. Generally, this is caused by a tightness in the front side of the hip flexor muscles and a weakness in the back side with the glute muscles. So today the exercises I'm going to show are going to focus on improving the flexibility in the front side and increasing the strength in the back side. So the first exercise is a stretch, and all you're going to need is a cushion or pillow, and you don't need any other equipment for the rest of the exercises either. So if, let's say, the left side is the one that's hurting you, you're going to put that knee down, and I'm going to demonstrate this from the side for a better view. Generally, people make a mistake with this stretch is that they jam the hip forward and cause long-term damage if they do this over time. What you want to do is squeeze your buttock muscle, squeeze your abdomen, and then you're going to push forward while trying to maintain an upright position. So meaning don't lean too far back or too far forward. You're just keeping straight and pushing forward. What you're going to do is feel a stretch in the front side of your groin, and you're going to hold it for 3 sets of 30 seconds or 5 sets of about 15 seconds. The second exercise is going to be called a quadruped glute extension, and you're going to perform it on the floor in a tabletop position. You want your hands under your shoulders and your knees under your hips. You don't want your back to be arching too much or rounded too much. So a tabletop position. And the way you perform it is, if the left side is again the one that hurts, you're going to extend your left leg backwards. At the top of this, you're going to be focusing on squeezing your glute. And you're going to repeat this for 3 sets. And you're going to perform about 10 to 15 repetitions. So brace up here and squeezing at the top. Exercise number 3 is called a glute bridge, and it's also used to strengthen the back side of your hip, the glute muscles. It's going to be performed laying flat on your back, and I'm going to show 2 variations with a progression for this. So first, you can start out with both legs on the ground, and you're going to focus on bracing your stomach and lifting your buttock off the ground. You don't want to overarch by letting the stomach relax. You want to keep it tight and squeezing the glutes at the top position. You're going to repeat this for 3 sets of 10 to 15 repetitions. And if it gets too easy, you can focus on one leg at a time. So if the left side is the one that hurts, the right leg is going to lift up, and you're going to use just the left leg to lift yourself off the ground. Going up and down. The fourth and last exercise is called a clamshell, and you can perform this laying on your unaffected side, and the side that hurts is going to be facing the ceiling. It's also used to strengthen your glutes just like the other exercises. So I'm positioning myself on the floor. You can have your elbow up or down, and your knees are going to be slightly bent to 90 degrees. What you're going to do is keep your feet together, and your knee is going to lift up, and you're going to focus on squeezing your glute muscles here. So you're going to repeat this 3 sets, 10 to 15 repetitions, just like the other exercises. And if you need to make it harder, you can try it in a side planking position. And that should increase the difficulty level for you if the other one was too easy.